Have you guys ever been injured and you are wondering, is it better to use heat or ice? This is a question that we get all the time in the office at Boulder Sports Chiropractic, and I'm gonna break it down for you. We're gonna look at a systematic review with meta-analyses, including 32 randomized control trials. So basically what they're doing is they are looking at how people react with eccentric exercises in a controlled environment, and then they are measuring their DOMS, or delayed onset muscle soreness measures. Now, if you're unsure what DOMS is, like I said, delayed onset muscle soreness, typically associated with inflammation of the muscular structures, and you're going to have a little bit of micro tearing going on in those structures as well. This typically happens when we're doing a new training program. If we're doing a new exercise, if we are an untrained individual just doing any kind of exercise for the first time, or if we're doing a new program where maybe we're not quite used to those movement patterns or just that type of volume or intensity. So we're gonna see a little bit of inflammation, typically get aches and pains in the muscles, which actually worsens as time goes on. So typically you're gonna hit the peak of muscle soreness around 48 to 72 hours after you exercise. So if you've ever had a workout, you feel okay the day after, and it just keeps getting worse and worse, chances are you're experiencing what we call as DOMS. So what they did throughout these trials is they took some kind of cold therapy, whether that was an ice pack, a cold water immersion, and they applied it to the muscles or the structures after the eccentric exercise, and they studied it. Now, what they found is there was actually a statistically significant reduction in DOMS when that cold application was applied within 1 hour of their initial exercise. What they did find, though, is if someone waited for more than 24 hours, there really wasn't any statistically significant improvements. So the point with this would be really, if you are going to be using some kind of cold application to try to reduce muscle soreness or inflammation after exercise, really important that you're doing it immediately after or within that 24-hour period, because if you wait much longer, you're not really going to see the benefits of that. Now, when they looked at the application of heat in order to reduce DOMS, or the muscle soreness after eccentric exercise, they were taking into account hot water immersion therapy, hot pack application, sauna usage, and ultrasound. And they found that out of all of those, the use of a hot pack right on the tissues was actually a better result for reducing the pain. Now, when we compare heat versus ice, they also found that using heat within that initial 24-hour period does show clinically statistically significant improvements in reducing DOMS. The benefit, however, which is different than ice, is they actually also saw reduction in pain and limitations if the use of heat was used even outside of that 24-hour period. So that could be an interesting thing to note. If you've been injured or had a really hard workout and it's been 24 hours, well, your best bet is probably using heat to help move through that inflammatory phase versus using ice. One of the theories as to why ice might work a little bit better is that when we are cooling the tissues, we're actually also cooling the nerves, and we're slowing down that nerve conduction velocity speed. So essentially thinking of just slowing down the signals going through the nerves that carry our pain signals. We are now moving much slower, so those signals aren't going to our brain and to the tissues as fast as they normally would. With cold therapy, one thing to consider is that really we're only getting a reduction in skin and tissue temperatures for about 1 to 2 centimeters below the skin surface, so less than an inch. Now, with DOMS, if we've had a really hard workout and if we are targeting muscles that are deep from the skin surface, thinking glutes is a really good example, the application of a cold pack might not be as great. So it's believed that heat application works really well for treating inflammation and tissue damage, because essentially we're just improving circulation and cellular metabolism. So our blood vessels are dilating, we're getting more blood flow to those tissues. It also has been shown to have basically a positive effect on muscle spasms, decreasing those muscle spasms spasms, as well as pain reduction. If you're injured within the first 24 hours, you're pretty safe to use either heat or ice, especially if you can get it on there a little bit sooner than later. Preferred applications are going to be either cold water immersion, so thinking ice baths, or an ice pack. For the heat application, you're going to be better off using a heat pack. And if it's been post 24 hours, you're going to want to think about switching over to using heat, as that is what the studies are showing. That still helps to reduce the delayed onset muscle soreness. And in theory, we can apply this to an acute injury as well. So yeah, maybe when in doubt, use heat. This is also something that I talk with my patients quite a bit about. I tell them how the research is a little mixed right there, comparing the use of heat versus ice with those, few randomized control trials that are actually out there. They're pretty inconclusive. We definitely need more studies. But in theory, my mind, when we use ice, we're decreasing blood circulation. Yeah, we're getting a little bit of decreased pain sensitivity just because we're slowing down those pain nerves. But when we heal, we don't want to just stay in that inflammatory cycle forever. We actually want to try to move through that inflammatory cycle. So there is maybe a little bit more of a risk of creating some swelling in an acute injury, say if you sprain an ankle and if you get a hot pack on there versus an ice pack. But the swelling is one of the basically steps that we need in order to actually help move through that inflammatory cycle, where our cells can go there and help begin the repair process, so we can move through that inflammatory phase and then into the recovery phase. So it's really important to know that this is studying the effects of heat versus ice within a 24-hour window when we are dealing with reducing DOMS and after eccentric exercises. This is going to be a little bit different of a discussion if we were to dive into the benefits of cold therapy and cold water immersion. That is definitely a topic for a different day. Lots of benefits. Really important to note, if you are trying to work on strength gains and hypertrophy, possibly using the cold application or cold water immersion therapy following your workout is not the best thing for you. It does not have any benefit. This is a little bit different if you are talking about quick recovery for your power training programs. So just as a little note, that is a topic for a different day. This is purely talking about DOMS prevention, in theory, injury recovery as well. Okay, let us know what you think.